Hi everybody, I'm Danielle. I'm the Business Development Manager here at Island Direct Primary Care. And for this week's podcast, we don't have a special guest. Well, I'm sorry, we do have a special guest. That's Dr. John, APRN. I mean, he's special like always. Well, this week or today, we kind of wanted to talk about what DPC can do for small businesses and how we provide healthcare to business owners and their employees. So, Dr. John,
Yes.
APRN, do you mind answering some questions about DPC helping small businesses?
No, not at all. I mean, actually, it's kind of interesting. So there's about 32 million people fall in that uninsured gap still today, even after Obamacare. And many of the small businesses, unless you have 50 or more employees, you're not required to offer healthcare benefits to your employees. Okay, it's just not mandated. If you have over 50 employees, then you have to offer healthcare benefits to your employees. If you have less than 50, you don't. So it's kind of a big topic of discussion, and it's a huge cost for our small business owners. Not true. We're actually finding across the United States, out of the 1,500 direct primary care practices that are out there, that even large employers are finding that offering direct primary care as part of their healthcare benefit, even with insurance, is reducing the overall cost to the business. Now, if we're talking specifically about the small business owner who right now just really can't afford anything, they could work with partner with a direct primary care provider and offer healthcare benefits probably for as low as $10 per week per employee if the employee absorbs some of it. I like employee buy-in, so I think they have a vested interest if they do it. And then the employer could get, pay the other $40. So for, let's say, sub $80 a month, that employer can offer healthcare services that covers a wide range of things. And those wide range of things are really dictated by the direct primary care facility. So here at Island Direct Primary Care, what's included? We like semi-annual physicals. I don't believe that you get to know your patients by just meeting them once. Okay, so we like to see them more than just one time for an annual physical. We like to see them a couple times a year because oftentimes something will happen. Their significant other or spouse will be like, hey, don't forget to tell your doctor this. And then, they got 8 more months until their annual physical. Other than that, they've been well. And so they don't go. And so by the time they get there, they're rushed in and out. So a lot of the direct primary care practices, they see one patient an hour. So this gives them ample time to discuss everything that's been going on since their last meeting, and it also allows them ample time for a good physical exam. And so those kind of things are included with the health benefit for the employers. In addition, it's those sick visits, right? So while healthcare is more than just sick care, how many times does an employee get sick and they call out from work and then they say they can't get an appointment with their doctor for 3 days, 4 days, 1 week? With direct primary care, most of them offer a same day, next day type service, which means they can start care immediately. And these small businesses rely on employees being at the office. I mean, if you're not at the office, you're not helping that company grow or succeed in business.
Right. Now, is there a cap on how many visits an employee can come into the office or see you per month, per year, however that may work?
Not at Island Direct Primary Care. Again, direct primary care practices across the country vary. I've seen a few, very few, that may say, 4 or 5 times a year and that's it. At Island Direct Primary Care, it's unlimited visits. There's no copay. There's no deductible. So as many times as they need to see us, they need to, they can just make an appointment. And I think, just recently you just made a really cool video that you posted on Island Direct Primary Care's YouTube channel about how simple it is to just really schedule an appointment.
Scheduling an appointment and becoming a member is a matter of minutes. It's very easy. on your phone, you pull up www.islanddpc, and it's right there.
Yeah.
It's like maybe 2-3 pages.
Yeah.
I made an appointment in, I think it was like 45 seconds. So when I'm able to go on the phone and pick my own time, I think that's a very special asset that we have.
Yeah, I call it's part of the cool factor, right?
Yeah.
But hey, if you're part of the island, you're pretty cool anyway. So.
Island style, like we like to
Island
call it.
style, that's right. So when we think about employee retention, right now there's, the job market's hot. The pandemic has kind of wreaked havoc on the small business owner.
Mm-hmm.
But yet what we're seeing, and we share a building with an urgent care, and they get hundreds and hundreds of people applying for jobs, and people aren't even showing up for interviews.
Mm-hmm.
And part of the reason why is because companies are just offering a wage. So let's say right now, the big thing is $15 an hour. I want to make $15 an hour. Well, what's included in that $15 an hour? I mean, do you think $15 an hour can include paying for healthcare?
No.
It doesn't, right? So if you have an hourly job, $10 an hour, $12, $15 an hour job, you can't afford health insurance that is known today on the healthcare market, right? It might be $400 for the employee. That employee is still responsible probably for about half of that, so $200. So imagine $15 an hour times 40 hours a week, which is what, $600 a week?
Yeah.
Is that the math?
Yeah.
Okay, so that's 600. So that's $2,400 a month. So almost 10%
Mm-hmm.
of your income goes to health insurance just for you, like if you were living alone,
Mm-hmm.
right? Not your children, not your significant other. So think about that. Then you add another $100 for your car insurance, right? So that's another 5%.
Mm-hmm.
Then you add on the next thing, right? Plus your rent and all that.
Yeah.
I mean, a huge portion of your income actually goes to healthcare. So direct primary care can actually give you access to care at the right time, at the right place,
Mm-hmm.
for the right price, for a lot less than what's currently being available out there. Now, it's not insurance. It's not going to cover your hospitalization or anything, but surely it's going to cover your preventative care,
Mm-hmm.
right? Prevention keeps dis-ease from happening. Occasionally people will get sick. Occasionally they will have an injury. And most direct primary care practices have the skill sets to deal with that. I mean, I'm classically trained in emergency medicine and urgent care.
Mm-hmm.
If you cut yourself, there's no reason for you to go to the ER unless you amputate yourself, right? You cut your arm or your leg, cooking or playing ball or working in the yard. I can do the sutures at the office for $0 to $100.
Yeah.
Right?
And it's that peace of mind of knowing if I'm sick, I can come in the next day.
Or that day.
Or I could call you.
You did it today.
Fine.
Dr. Nolan, nurse practitioner, and myself, whenever we have those gaps in providing healthcare, like, when we don't have appointments, we spend a lot of time reading and researching, keeping up with some of the latest healthcare modalities that are going on. And so we'll get in a rhythm. Sometimes we'll be doing case studies and talking to each other about some complex cases. We have a collaborating physician too. We may be talking to them. Hey, we had a patient that came in with X, Y, and Z. Here's our plan of care. What do you think? And so we like to use that time to collaborate. So we like an hour heads up before people come in. But at the end of the day, if someone has a need, then that's when they don't go online. So when you go online to make an appointment, it has to be at least an hour ahead. But they can call us too,
Mm-hmm.
directly. My number or Nola's number, and say, hey, look, I just cut myself. Can I come in and see if I need stitches? Or I just fell down and my arm is not in the right place.
So does having a direct primary care help with recruitment?
Danny, I think that's a great question. We're in a very competitive market. Being in the United States, wonderful country, we're capitalists, we're entrepreneurs, and we're always trying to be innovative and find out what's the next best thing, what's the next best product. And here on the Space Coast, there's all kinds of awesome things happening. Satellite companies, space companies, you know, Elon Musk and Jeff Bezos are fighting it over between Blue Origin and SpaceX. And it's just like, how do I get not only the highest quality employee to come work for my company, but what about those contractors that are supporting those missions and those larger companies? And the way to do that is to offer them something that someone's not, right? And direct primary care is one of those somethings that's very, very cost effective. I mean, less than $100. And so if it's less than $100 and you can offer to them and people can get health care when they need it, right? Without any copays or deductibles, and someone who actually spends time to listen to them and that's focused on their health and wellness, that wants them to live their best life and really look outside the box on, look, no medications, let's focus on your lifestyle and really living optimally to take the benefit of those higher salaries, right? I mean, it's a no-brainer to me. I mean, really, for less than $100 a month, you tell come join our company, here's your benefits, plus you're going to get direct primary care. What that means is you're going to have your own personalized healthcare provider for you and your family, that you're going to have their phone number, and you're going to be able to reach out to them when you want to, when you need them, and they're going to be there for you. And I think that just, is a tremendous benefit that these companies can use to recruit a higher level of talent.
Can you explain what it would be like if I needed to get laboratories done and if I do or don't have insurance?
Oh, absolutely. It's kind of simple. So at Island Direct Primary Care, and this is not uncommon with many direct primary care companies across the country, we actually have negotiated contract rates with LabCorp and Quest Diagnostics. So if a company actually has health insurance for their employees, or if an individual has health insurance, then they can use their insurance for their labs. They just say, look, my insurance company wants me to use Quest, or my insurance company wants me to use LabCorp, or my insurance company doesn't care. Then on the flip side of that, some people have a high deductible, and then this is where direct primary care's value really starts to shine, is if you have a high deductible, you don't have health insurance. So for Island DPC, because we have those relationships with Quest and LabCorp, we know where the cost most effective labs come from. So to give you an example, we can get a complete blood count for $2.30. Well, our patients pay $3 for that. We can get a comprehensive metabolic panel for about $2.70, $2.80. They pay $4 for that. A lipid panel, which is looking at cholesterol. Again, the total cost to the patient's $4. I think Quest, the total cost is $5 because it costs a little bit more. But you see, it doesn't cost a lot of money, whether you have insurance or don't have insurance for those kind of things. I mean, I remember seeing a cost for a testosterone free and total for $385, or $384 to be exact. And for us, it cost us $17. So our patients pay $19, right? And so for many direct primary care practices, laboratories are not a profit center. So let's talk about some other cost-effective solutions, or the value, monetary value, that's included in your membership. Many of us have our own x-ray machines or access to an x-ray machine. So x-rays, $40. We have multiple relationships with imaging centers across the county who offer cash pay prices, even better than the insurance pricing, right? And so that cash pay pricing may be $200 for an MRI, or $150 for a CT scan without contrast. We also have relationships with medication companies. So we have a distributor, so we keep some medications in-house. I personally, and Nola personally, we work with a lot of the independent pharmacists, and they've agreed to help develop formularies for the lowest cost common meds for our businesses in the area. But for, the smaller companies, I can literally get a Z-Pack for $1.83, and my patients pay $3.
Is there anything else the community should know about working with a direct primary care practice?
I think the last thing that we could probably hit on, and it's not specific, it's in the fact that working with the direct primary care practice allows businesses and the primary care practice the ability to work together as a team. So they're extremely flexible. So for us, we have, like Dr. Nola, nurse practitioner, actually has a strong background in occupational health. So we're in the process of developing occupational health type programs specifically designed for specific companies. And so when you're working with traditional healthcare providers, you don't have that flexibility. And so working with the direct primary care practice, you can kind of design that how you want, determine what measurables you want to do so that way they're evaluated, and work together as a team so you can really truly see how healthy your organization is. Because after all, a healthy organization is a happy organization, and a happy organization is a successful organization. So I think that's probably the one thing that, we really can't speak to specifics on because it's so personalized. But that's one of the things that really excites me most about direct primary care and employers and employees in our community, especially because the Space Coast is blowing up.
It is. Well, thank you for taking your time to talk more about direct primary care along with small businesses in the area. I appreciate that.
Me too. Thanks for, saying, hey, look, Dr. John, nurse practitioner, this week we got a break, so why don't you and I talk about what's going on in the community with small businesses. I think you said February 16th, we're going to be talking to Jessica Bill, who is a compounded pharmacist local in the community. And then also we have another guest, Jessica Schneider, who is involved with thermography and all kinds of other alternative modalities.
It's going to be an exciting few weeks.
It is. So thank you so much for coordinating that. And till next time, we'll see you on Island Time.